The chair now recognizes Mr. Fry from South Carolina.
Thank you, Mr. Chairman, for having this hearing today, and thank you, Mr. Dodaro, for being here. The American people deserve to know where their money is being spent. I've talked with a lot of my constituents since being in Congress, and I know that they are hurting financially. We see that in inflation and other things. They have to decide right now between gas in the tank or groceries in the fridge. They have to say no to a lot of things right now. That is why it's so hard to look at this high-risk list. It makes me disappointed, it makes me frustrated, and I know that these big agencies and programs are prone to risk. They need to be good stewards of the taxpayer dollars. If the American people have to cut back on spending, why not the United States government too? Why not reform the way that we operate our agencies to account for the American taxpayer? I represent the 7th District in South Carolina, home to South Carolina's finest beaches and golf courses. It's a premier retirement destination. That being said, I also represent a lot of people who are on Medicare. In fact, my district has the highest population of Medicare beneficiaries in the state, with over 201,000 people enrolled. Mr. Dodaro, I want to talk about Medicare today, which again makes the GAO's high-risk list for, what, the 3rd decade, I think, at this point in a row. The improper payments going out under Medicare total nearly $81 billion. That's roughly 15% of the total costs of Medicare. I bet Americans would love to have a little piece of that back. So I get it. Medicare is a giant program with things going on. They slip through the cracks. In fiscal year 2022, $47 billion of Medicare funds were improperly paid out. Mr. Dodaro, where is that money going?
I'll ask Ms. Farb, our healthcare expert, to respond.
So a large portion of the improper payment rate that's calculated by the agency is driven by lack of documentation. So it's hard to know if the payment was made improperly, meaning it should be returned, so there's a monetary loss, or if there just was a lack of documentation. For example, a clinician didn't provide the information needed to approve the claim. So one of the things we've recommended in the past is that CMS take a look at the documentation requirements for clinicians and try to balance the idea of not overburdening clinicians, but also making sure that documentation, requirements are easy to meet.
How much do you think is being distributed to fraudsters who are intentionally trying to rip off the federal government?
I don't have an estimate of the exact amount of fraud, but we can get back to you on that for the record.
There's definitely cases that have been brought. In fact, most recently, within the last year, I think one of the biggest fraud in the Medicare program has been done by the Department of Justice under the task force. We get you clearly there are big cases of fraud involving a number of people.
Right, thank you. And how much, would you say that most of the money is because of improper payments from clerical errors or otherwise? Is that where most of the loss is?
It can be going to ineligible people. It could be going to ineligible providers. It could be going to the wrong amount. Most of this is overpayments. Some of it's underpayments, but it's a very small percentage going to underpayments. But the frustrating part, as Ms. Farb mentioned, is that in a lot of cases there's just no documentation to tell. And if you were audited by the IRS, they'd want to have your documentation. But a lot of the people in the federal agency said, well, it's just a documentation problem. Well, I said, we should have the same requirement when we're spending money to make sure you can adequately explain to us why you're spending that money as if you're getting audited by the IRS. So that's a problem too.
How do you think that we can prevent this? I mean, what are some steps that can be taken, these agencies can take regarding Medicare to make measurable progress here?
Yeah, well, they need to, they'll need to do more audits of Medicare Advantage providers. They're way behind in those audits. They still haven't released the audits from 2011 to 2015. And Jess, you want to add?
Well, also, they should allow the recovery audit contractors to conduct prepayment reviews. They get a percentage of post-payment reviews of this pay and chase model we were talking about earlier. But if they were allowed to do prepayment reviews and more of that, then that would help. And Congress has to give them some of that authority. So.
Yeah.
What changes or strategies that have been implemented in other agencies or programs to remove that agency from the high-risk list would be useful to the Medicare program if they were to apply?
Well, one would be to continue to have an action plan to deal with these issues with goals and measures. Like, they don't really have a goal right now that I'm aware of anyway, where they would reduce the improper payment to a certain level. And one of the problems that we have is that you need to have a goal to know whether you're making progress or not. Now, they have been bringing down the improper payment rate, even though these are big numbers yet, in the Medicare program. The Medicaid program is going the other way, and that's, to me, a bigger problem in Medicaid than there is in Medicare right now.
Thank you, Mr. Chairman. I yield back.